Good afternoon. My name is Michael Campbell, and I am your Master of Ceremonies today. I am the Chair of the Alameda Public Health Commission, and I also am the Project Coordinator for Lifeline at Ultimate Summit Medical Center. Yay for Ultimate Summit! Yay for Sutter! And also for my friends out there at Sutter Care at Home, I promised you a shout out. Today is the National Health Day Decision Day, and this is the Conversation Campaign celebrates the life of stories. So without further ado, I would like to present to you Alex Briscoe, who is the Alameda County's Director of the Health Care Agency. Alex, I know you're here. There we go.
Hi everybody, thank you. So as I think you know, today is National Healthcare Decision Day, and it's celebrated across the country, right? It's not just here. But for us, it's an attempt to do something relatively subversive. As you probably knew, that about 85% of all health expenditures are expended at the end of life. So I'm going to test something on you. We see today, as part of an effort to wrest control of one of the great truths of human existence, which is the fact that we're all dying, from those who would make a buck on you, to those who would see this great truth as a time for connection, for kindness, for empowerment, maybe even for spirituality if you so choose, but also for starting where we should have started in our healthcare system, with the needs of patients and their families, to live a fulfilling life at every point in that continuum. In Alameda County, we've used today to culminate our conversation campaign, which with just a very teeny little bit of money, we went out there and took a careful look at utilization of hospice across every strata of our county. And we saw some disturbing, but frankly quite common things, that some communities, particularly communities of color and poor communities, were not using one of the great tools of our healthcare system at the same levels that other communities were using that. And we made it a specific goal of our effort to hire staff, convene collaborators, and begin a learning community to look at hospice utilization across the county and to ask that question of, are we as a healthcare system promoting our clients and families to get the most out of their life and to reclaim the power that we often give up to health systems and providers. It's a simple idea, right, that maybe you are the best clinician and that your doctor knows no more about you than you do. And if we don't begin a process overtly of wresting control of our health and wellness from a healthcare system that has shown great skill at profiteering and not such great skill at improving healthcare outcomes, we will fail. So we have a subversive message to deliver to you today. The Conversation Campaign is about you knowing more than anyone else about what it takes to live a happy and healthy and fulfilling life. We also have another piece of subversion to offer, which is we have to break this incredible cost that our healthcare system bears in terms of spending money at the end of life. As precious as life is, extending it through unnecessary human suffering to the benefit of healthcare systems and those who would profit on us is not acceptable. There are other ways to do this. But unfortunately, even for many who have thought about the end of life, very few have actually written down their wishes. And so our effort today is also in the Conversation Campaign about connecting people to more specific tools and supports so that they can make plain what they want and hold the healthcare system accountable for delivering it. The Conversation Campaign is a project of our Getting the Most Out of Life and Hospice Providers Coalition. I want to thank all the Hospice Providers Coalition. When we first started this process of inviting providers together, we began with a really simple idea that we don't know what to do, but you're doing the work. Come together with us, let's talk about how to make it better. And it's amazing what an incredible tool that is. Common cause, good intention, and time can improve people's lives. The problems we've made have been made by human hands. They can be unmade by them. We've received the sponsorship of a number of elected officials. In fact, it's a delight to work in a progressive county where elected officials both support and fund efforts like this. You're going to hear in a second from Supervisor Carson's office, the president of our Board of Supervisors, But I also want to quickly mention Mayor Jerry Thorne from the City of Pleasanton, who gave us a proclamation today, Oakland Mayor Tom Bates, Dublin Mayor Tim Sabranti, Supervisors Nate Miley and Wilma Chan, champions of older adults in Alameda County. And I need to say, just from a demographic perspective, it's coming, right? 150% increase in people over the age of 65 in Alameda County by 2025. We sometimes call this the gray tsunami, but there's a massive demographic shift happening in our county, and our healthcare system is not prepared for it. Sean Milano with Assembly Member Bob Wachowski's office, Jackie Orpiles here from Rob Bonta's office, and Dr. Ray Graham from the City of Fremont is also here. This conversation has taken players at every level, from physicians, from elected officials, from us bureaucrats, but most importantly from providers of hospice and end-of-life services. We're really grateful for joining us in this effort. And it's a unique one. Alameda County launched this, I think, about a year and a half, maybe 2 years ago now. And as I said, we spent a teeny little bit of money trying to get people together to talk about how to make it better. So I'd like to now introduce Amy Strako from Swedish Carson's office, who would like to make a welcome on behalf of the Board of Supervisors.